Hi, good evening. Welcome to another episode of Let's Talk About Mental Health. My name is Nels Kloster. I'm an addiction psychiatrist working in southern Vermont.
And my name is Robert Stack. I'm a drug and alcohol counselor and a licensed mental health counselor. And last week we ended up the show. It was a question about women and alcoholism and women and addiction. And, I actually said something to the effect that, women enjoy alcohol just like men enjoy alcohol. And in hindsight, I look back and I'm one of those things you wish you hadn't said, because it seems kind of flippant. But what I meant is that women are as much at risk for dependency, for alcohol and drug addiction, as men are. And so I feel like I could have been a little bit clearer about that. And the other thing I'll mention right from the beginning here is that, I've grown sort of suspicious of books like they're written about women by men, here we are, two men, we're going to talk about women and addiction. And I would just say that, I'm probably be talking from firsthand experience, the clients I've worked with over the last 30-some years, some book learning, but I guess I'm willing to admit that I may, at some point misunderstand something or misstate something, but I really do think it's sort of worth us taking this show or this program to talk about some of the special needs or special attentions that we need to pay when we talk about women and addiction and mental health.
Right, yeah. Yeah, I think too, I like that kind of warning that given the work that we do, we know that a lot of people change on their own. If you look at how many people use and then you sort of extrapolate then to how many people run into problems with addiction and how few people come into treatment. I mean, the statistics are like 5% of people actually find their way to treatment when they struggle with substance issues or think they have a problem. We're working with folks who have, I don't want to say reached the end of the line, but sort of the far end of the spectrum around their addiction. And so we're sort of, what I call sort of a selection bias. Basically, we're at risk of thinking that the whole world looks like the people that we work with.
Right, right. And I think that, when I first started in the field, like 30 years ago, there weren't that many opiate addicts. For instance, there weren't that many opiate addicts in Vermont. And so there weren't very many opiate women addicts. I mean, you very rarely ever saw them. And almost always when you saw them, you had to, you wanted to think about, was there some trauma involved? And as there's become more and more opiate addicts in the state of Vermont, there's become more and more women opiate addicts. And I'm hoping that we don't just, I don't want to just talk about opiate addicts, but it's almost worth mentioning that, there's also women alcoholics. And women alcoholics sometimes will have a different course over their lifetime than male alcoholics. It really looks different sometimes. I mean, and especially if there's children involved. So I think, as we're talking, I'm hoping that we'll be able to say both a little bit about what are the risk factors for some women, and also what are some of the recovery things that are of some concern for women in recovery. And so you want to say, I think you said it earlier, and I'm not going to say it as well, but we want to treat women as if they're equal, but we don't want to treat them as if they're
the same.
They're the same.
Yeah, exactly. Right. I think that there's maybe a misinterpretation of what equal rights means or what women's liberation was about, that men and women are sort of androgynous. They're both the same sort of thing, and we just need to teach men to act more like women and women act more like men. But I think over time we're realizing that no, there are very distinct differences between men and women, and we've seen this in treatment. If you have a mixed group, or you have an all-women's group or an all-men's group, the conversations, the sharing are very different. And a lot is written about difference in communication styles between men and women. I mean, there's the men are from Mars, women are from Venus is an example of that. Another one called You Don't Understand Me, which is actually written by a woman, Deborah Tannen, who was a psycholinguist. And we know that that's part of the conflict that with men and women when we're together. We just don't sort of speak in the same way and with the same purpose.
Right, and if you don't mind, I want to go back to that idea that when I worked on a unit with a lot of, a women's unit, there were women who had been traumatized. Substance abuse was part of the diagnosis. I mean, it was one of the things that you looked for. There were certain characteristics or symptoms of the diagnosis, and one of them was substance abuse. And a lot of times you saw alcoholism and drug addiction involved in the family of origin. And it's kind of one of the folks that we work with here says, very rarely do you ever hear as much talk about the perpetrators, who are often men, in sexual trauma in families. And I'm sure they're traumatized by that experience in a different way. You know what I mean? Like in a different kind of way. But a lot of times when I was working with it, and you would almost see it as alcohol and drugs were involved in the incidents in their childhood, and then they were at risk to develop their own dependency, their own involvement. So
yeah, and family heredity gets talked about a lot in this as well, right? That people who have committed, and again, it's a crime. It's a crime against humanity. It's a crime against women. Often it's a crime against men as well. So we don't want to excuse it. But there is this history of having been a victim before being a perpetrator quite commonly.
Right. So, and one of the things that I've noticed, and this is, I'm going to try and be careful about this, but one of the things I used to work with like 20 years ago, a lot of the women that I saw in treatment were perhaps middle-aged, more older women, and they had, drank just like everybody else when they were kids, and then they sort of stopped, or they cut it way back when they had children and their families, but over time, what used to be a glass of wine became a bottle of wine, and especially as they got older and their child care responsibilities became less, and maybe they went back to work, maybe they became much more part of the workforce, and it's sort of you've seen an increase, at least I did, of people coming in. And they would come in, and the sad thing is that a lot of times they would come in, they would have a real hard time with this idea that they were alcoholics. Because of the alcoholics in some ways is stigmatized. There's a lot of shame attached to it. And for a lot of women, this idea that they would be alcoholics, it didn't...
Right, because the whole thing of being functional, that so many people take as another adjective around being alcoholic, right? Oh, a functional alcoholic. I might drink like a fish, but I go to work the next day.
Right.
But eventually, this is a progression, right? Like we've talked about sort of the hallmarks of a disease, and one of the things that classifies something as disease is that it causes dysfunction, and that it's progressive and it's potentially fatal. And this just sounds like a classic example of the drinking progressing through the course of her life, and then maybe when there's sort of some holes in her life as she goes through various transitional stages, then particularly around the empty nest and children leaving, that you find that she's sort of set up then, that this increasing amount of drinking then increases even more to sort of fill this hole or this need.
Right, and the other idea is that for some of the when I first started working in the field, if you had 1 or 2 women on a unit of 25, that was a lot. That was the average almost, I think. And nowadays, I would say it's about 50%. And I don't think there's more women alcoholics, but I do think there's more women getting help. I think there's more women coming in for treatment. I know in my own personal family, one of my father had 7 brothers, and one of my uncles, one of my aunts drank. And she was sort of protected. She ended up drinking, dying of alcoholism. But no, she never went to treatment, or she never got a ticket. She never got a DWI. I don't think she drove.
Yeah.
You know what I mean? It was like, so in some ways, we used to talk about alcoholics having denial, or rationalization of substance use. But I think sometimes for women, the family would have denial. They would know about her drinking, and they would know about, she drank more than, they expect. But I think in some ways, I don't know, it's almost as if the families would become part of the denial system. And they were very protective of them. And the sad thing is that at that point, if they're not working and they're not driving and they're at home, sometimes you can sort of hide the alcoholism, and they never get help. And so I think in some ways, and I read this the other day, that as women become more liberated, they they get in the workforce, and therefore they be more at risk for alcoholism and stuff. But I think they're more likely to get help. I think they're more likely to get treatment. And you know, I don't have the numbers statistically, but I've seen it. You know, as I said, in my own life, but I've also seen it in my work. You know, I think that women are getting help sooner. And the other thing that has sort of driven women into treatment, I think, is the use of drugs. There was a time when drugs were sort of not that available. There wasn't that many prescription medications out there. There was alcoholism and, you know, maybe pot. Heroin addiction was a really another section of town or you know, different subpopulation. But now I see, you know, I think drugs in some way is like an accelerant. It sort of picks up that addictive process. And so I think you're seeing young ladies, young girls in their 20s who, you know, started drinking with their boyfriends when they were in their teens, and then, you know, they smoking pot, and then they did some coke. You know, they like to party just like men like to party. But I think they're always at risk, just like men are, to take like, you know, start taking opiates. And all of a sudden find out that, you know, what was done voluntarily, they find that they can't stop.
No, they need it. Yeah. And I think, I mean, there's been a lessening of the stigma around all these drugs too. Kids are taking prescription drugs because, well, they're prescribed, so they must be okay because doctors prescribe this, so it's got to be a safe medication. Looking at sort of what's going on with marijuana, you know, trying to call it medicinal, which seems to be a stepping stone to making it legal. So again, people say, well, it's safe. There's nothing to worry about there. And so when you have that attitude, and of course we know that the earlier you start to use something, the more likely you are to run into problems with it.
Right.
That you really sort of get off a path and get into trouble.
And I won't get into the whole thing, but there's a wonderful woman who goes around the country to talk about advertising. And one of the things she talked about was the liquor advertisers and the alcohol, trying to appeal to women, that this is part of liberation. Women's liberation is to become a drinker like men. That, you know, that they have a right to drink just as much as men do. I mean, and there is a certain, if you looked at some of the ads, there is a certain amount of selling. You know, they show women in bars, or they, you know, in a joyful setting. You know what I mean? Like they're one of the boys watching a football game, drinking. You know what I mean? It's like that, as if like this is something you can aspire to. This is something that you can grow to. So I think there's a lot of different factors that influence how women get involved with drugs, or how they get involved with, whether it's through their boyfriends or environment or wherever they are. But the one thing that you and I talked about, and I wanted to make sure I mentioned it, was I've worked with a lot of women that when they became pregnant, or when they, you know, they literally stopped partying. And they put down the bottle.
Stop smoking, stop drinking, boom, just like that, right?
That's right. And it's amazing because, you know, I've worked in the field where, you know, people say, I can't stop, it's a disease, it's an illness, I can't, you know, I acknowledge that, it's okay. And yet I've seen this. I've seen it over, repeatedly, over and over. And this is especially true, and again, I hope you can say more about it. With the first child, I'll see, you know, and sometimes, you know, later on with the second or third child, they find they can. And so, you know, you can see that other piece of it. But I've had women say to me, I stopped using and drinking as soon as I knew I was pregnant. And then as soon as I stopped breastfeeding, I started up again. I mean, and they don't mean that like in a sort of willfulness.
Like they've been waiting for that
moment.
moment.
No, it was more like almost natural. You know, once I stopped breastfeeding, I went back to it. And I think in some ways, some women who were maybe at risk, they get involved with families and the kids, and you never really get back into drinking until later on, and they run into the sort of what they call empty nest. But later on in life, maybe they get back into drinking. But they're so busy being parents and mothers that they just don't do drugs. And they don't, you know.
Absolutely, but they're still probably the same partner, maybe, still have the same family tree, still probably living in the same neighborhood. And so you have all these things that conspire, and eventually, I mean, they use this expression a lot in addiction for some reason. I don't know why they say this, but if you go to the bar, if you sit in the barber shop long enough, you're going to get a haircut. Right? And so they're all, meaning don't go to the bar, you know, don't go to the package store to get your gas, you know, those sorts of things. But so here they are, with the same partner who's probably still using drugs, because I've noticed that the pregnant mother stopping, whether it's the smoking or the drinking or whatever, doesn't seem to bleed over into the father doing the same things. He
Right.
seems to think that he can still do these things. I'm not carrying the baby.
Right.
And so that, of course, then sort of feeds this environment that makes a woman quite prone then to returning to her drug use once she's had the baby. Although a lot of women have this period where they're not using. But you're right. I think it's been really a strong example of how addiction is a progressive illness, because I've noticed that when I meet a lot of these women who have stopped in the first pregnancy and then with the second pregnancy find out that they can't stop, they're very defeated. They're ashamed. I did it before. Why can't they do it now? Not recognizing that the illness has gotten worse. And that actually tends to be sort of an impediment to them getting into treatment, because they struggle with this. I should try harder. I should have stopped doing this. What's the matter with me? And so quite often for that, for first or second pregnancy, you find that because of these factors of shame and guilt, that they put off getting to the treatment because it's just so much harder to make that acknowledgement. And so it's often not until the second trimester that they often sort of present themselves saying, I need help.
Right, and I think that also brings up another issue. They used to say years ago that if you're interviewing an alcoholic and you ask him how much he drinks, he'll tell you less. Right. If you're interviewing an addict, he'll tell you more.
Right, yeah.
He'll tell you more. And I think in some cases with women, nobody even asks. And I think sometimes they're not even aware of it, and they don't want to talk about it. Again, we mentioned the issue of shame. But also that whole characterization of women as what does it mean morally? What does it mean, like, if they're using substances? And I think sometimes that really, it gets, I'm not qualified, and I hope you will say more about this. But
for
instance,
give a woman's point of view, you mean?
No, but from a medical point of view, I mean, normally, and we talked about this earlier. One of my concerns when I was working in the is fetal alcohol syndrome. And we used to worry about women that were drinking, and they're heavy drinking, alcoholic drinking, and we sort of believed that the alcohol affected the child in the womb, in utero, and we always worried about the second trimester, and we would worry, about the effects of it, and so, and why it happens, and who it happens to. And of course there was always that concern about crack. They always had this special laws, that if there was a mother was using crack and she was pregnant, we could put her in jail. We could, there was a recent case of that. And again, research says it's not true, but the one point I wanted to make, and I know you have experience with this, is that we find that's not true for women who are opiate dependent.
Right.
And I wonder if you'd say more about that.
Yeah, no, absolutely. And I mean, I think, as we talked about before, like around that whole sort of crack baby epidemic, of how there were really a lot of racial overtones to that, which caused people to react so strongly. But it also then pushed a legislation that we see these days about having child protective services involved. If you have very clear evidence that mother's been using during the pregnancy, to then have interventions there in place, to give the child a safe place to live, or to help the family to raise the child. But alcohol is sort of unique, because the thinking is that there's no safe level of drinking in pregnancy, and no safe time to drink. One of the reasons why you suggest that women of childbearing age take multivitamins with folate in them is because during those first weeks and months, what's called the neural tube is developing, and that's what's going to become the spinal cord and the brain. And if you have anything that's going to impact that, particularly a lack of folate, which is something that's associated with heavy alcohol use because it sort of replaces good food intake, then you can have these sort of malformations. And but then too, with fetal alcohol syndrome, there's certain sort of what are called anomalies, misconfigurations, and particularly of the face that you'll notice, features of the ears and the eyes and the nose, and facial features tend to develop later on in the pregnancy too. So I think it's safe to say it's really not a safe time to drink whatsoever. And now with the other drugs, so alcohol is kind of unique in the idea of having birth defects or anomalies present. The others, cocaine, marijuana, the opiates, we don't see those sort of birth defects. Now with all of the drugs except for marijuana, you'll see some kind of decrease in the size of the fetus. So you birth maybe a slightly smaller baby. But like a lot of other sort of difficulties that happen or complications that happen with pregnancy and drugs, that doesn't persist over a long time. So by the time kids are a year old or even older, they're back to sort of normal size. You wouldn't be able to recognize them as being in a different place on the growth curve.
Right.
They tend to be in the same percentile as their parents are. And behavioral issues, cognitive issues, they're rather subtle. And you can find some nuances of that, but then you can find studies that would tell you, yes, there are some deficits that come about from various types of drug use and some that are not. So right now, I think for alcohol, we say, okay, look, don't do it. The risk is really too great. For the other drugs, get help, get treatment. And that the children can do well enough so that by the time they reach school age, you're not noticing them to have deficits that are necessarily tied into their drug use, but usually more in sort of the chaotic setting. That seems to be more important. Poverty is, when you talk about a gateway drug, poverty is really the biggest risk factor for developing problems with mental health or addiction. And the family, the social relationships, and adverse childhood events, those are the things that play a larger role in not being ready for school, not being able to learn in school, and to developing addiction problems as you age.
Okay, and I wanted to spend a little time, and we talked about this, and that women, well, like I said, I was seeing toward the end of my career in the hospital, more and more women on the unit, and almost 50%, which I thought was very positive, and I think they are getting better and more into recovery, and there's more women in recovery, but again, it's kind of interesting. And I don't mean to sort of belabor this, but often you'll hear women sort of have to. They're always juggling family responsibilities. They're, they're juggling childcare or whatever. And I said before the show, it's sometimes, you say something about coming to counseling or going to meetings or something for recovery, and there are meetings that welcome children, or they have places for children to play. I think the Saturday night meeting up on Putney Road has an area for children to play and stuff at. But the idea of like getting your kids together, you know what I mean? Like if you've ever tried to put together, we're leaving, and we're going to get this, we got to get that, and I don't think men have that problem. They get in the car and they drive, they sort of go to the meeting, and I don't mean that in a mean way, because more and more men are good fathers and they're good nurturers and stuff. But you don't often see those issues in recovery for men that you see in women.
It's not fair. It's not fair on the recovery. We know that women bear the brunt of most of the child care. And I think that another piece of the unfairness to this is that, women are still, despite this idea of equality, are still raised to be good girls.
Yeah.
And what good girls do is they don't act out in school when they're younger. They don't tend to be diagnosed as having ADHD, so they're less prone to be treated for problems growing up. And they still get encouraged these sort of, caregiving sorts of roles. And so as much as we've tried to make that different, you really find that when you talk about recovery, they're really bearing an unfair brunt of this. We were talking about this before the show. Quite often, my women patients come to see me, and they've got one or two or, kids with them. The guys, very seldom is there a man who comes to treatment with the child without the partner being there. I get some partners, so they come with kids, and the guys come by themselves, and quite often the women come with their kids, and they struggle with not only just sort of the logistics of sort of how do I pull the kids together, how do I sort of get there, but quite often you're dealing with addiction, you're dealing with poverty as well. There's not two cars, there's any car, and you're constantly sort of begging and trading and cajoling in order just to get transportation to a weekly appointment. I have so many women who miss appointments because they just can't get a ride. They can't get somebody to watch the kids for them. And that is really a big hindrance for them.
Right, and I'm hoping, and I know that we're planning on doing a special show about this, and I really think it's a worthy thing to discuss. And sometimes people complain about our medical taxpayer dollars being spent, for addicts and alcoholics and healthcare and stuff. But I think when you're dealing with, and I've almost universally seen this, women saying, I want to take care of my children. I want to take care of my family. And I think in a lot of ways we should do everything we can to give those children a chance. I mean that quite frankly. And we need to, I just want to mention this, and I'm afraid by mentioning it I'll make it public, but sometimes there's criticism about women and going to meetings and going to places in recovery that get hit on by men. And my response was sort of glib, and I would say, well, you're used to getting hit by men trying to hit on them and flirt with them and whatnot, but I think it's a little different sometimes in the recovery community, and there are couples that get together, and there are people that are successful, but there's also, and I'm sorry to say this, but it's a really risky time emotionally. Yeah. And sometimes, when you hear somebody and you meet them, I guess, in a bar, or you meet them someplace where people are getting high, you can make your judgment about who's here and who they are. But sometimes when you meet them in a recovery setting, and people are talking about love, or they're talking about a higher power, they're talking about prayer, I think it's sort of, sometimes you don't see the warning signs. You know what I mean? You find yourself being a little bit more vulnerable. You see yourself being, and I think a lot of alcoholics and addicts, especially when before they get into recovery, by that time, a lot of times, even they're alone or they're isolate, I think they're at higher risk sometimes to get into relationships, and we're going to hopefully talk about that next week. But it's that idea that, that you have somebody who's really wants to be loved or be in a relationship, and yet they find themselves, for whatever reason, making poor choices and decisions. And I mean that both for men and women. Yeah. But you see that sometimes with women, and I think in some cases it's... I would say to a woman, you should get a woman sponsor, or you should be with a woman, and they would say, well, I don't like talking to some women. You know what I mean, right? Yeah. I'm not that comfortable, and it's sort of. I think it's a real challenge. I'm sorry.
There's some really strong forces competing with each other here. I mean, on one hand, when you've gotten to the point of addiction, alcoholism, other substances, your maturity has been hindered. And part of maturing and the growth of the brain is judgment, right? Sort of governing, sort of internal parent says, no, I shouldn't do this and that. And so that, of course, is what's inhibited quite often, sort of the frontal lobe, the piece of the brain that develops last. So you have this decreased judgment that comes from a lack of maturity from your addiction. While you're using, of course, there's a decrease in judgment there as well. But then you're often of an age where you're of childbearing years, of the time when we're used to kind of getting together and creating families. And so you have that desire for intimacy, that really these things conspire in such a way that it becomes quite a struggle, because you're trying to fight against a lot of natural forces.
And I would just say, and again, we were talking about women, and every woman is different, and every woman is an individual. So when we make these big statements, I can think of so many things I'd like to say, like footnotes, well, then don't forget there's this subset and that subset.
It's hard to do this justice in a half hour.
So, so next week what we're going to try and do is follow this up with a little bit of talk about intimacy and relationships, both the impact of mental illness and addiction before and after, and do the best we can talking about it.
About these sort of competing forces.
That's right. So.